people may be speculating whether the government is going to announce ease up of the lockdown soon. But what we heard is we have to keep our guard high and keep stringent measures for now. Especially Dr. Tawisin has also outlined 6 conditions by World Health Organization, Kun Thepchai. If we want to ease up all the restrictions, we need to have this in preparation of 6 conditions. So let's take a look what's the condition specified by World Health Organization.
The World Health Organization Director General understands the urgency of many countries to restore normalcy by easing some of the restrictions, but he insisted that there are at least 6 conditions that need to be met first before these restrictions could be eased.
Yes, like the first one, disease transmission is under control. That's what we need to make sure, that the disease transmission is under control. The second, health system can detect, test, isolate and treat every case and trace every contact. And the third, outbreak risks are minimized in vulnerable places such as health facilities and nursing homes. So that are 3 outlines, 3 guidelines from World Health Organization. And the fourth, schools, workplaces and other essential places have established preventive measures. Fifth, risk from imported new cases can be managed. And the 6th condition, communities are fully educated, engaged, and empowered to live under a new normal. So that 6 conditions by World Health Organization according to Dr. Tawisin Kun Thepchai.
Dr. Tawisin pointed out the last 2 conditions as outlined by the World Health Organization. The one that has to do with risk from imported new cases can be managed or not. Of course, we have been hearing about Thais, thousands of them waiting in line to return to Thailand. So this is probably one of the biggest challenges facing the government on how to deal with these returnees. Of course, as Kunatha has reported earlier, that the Thai authorities believe that they have the hospital capacity to deal with a maximum of about 200 people on a daily basis. That means that any returnees, any number of returnees should be limited to 200 daily, so that it would not put too much of a strain on the medical capability of the country. But of course, we have thousands of Thais waiting to return, including at least 3,000 waiting across the border in Malaysia. And then there is also the question of whether or not communities are fully educated, engaged, and empowered to live under a new normal. Because as Dr. Tawisin pointed out, there are still a lot of people out there who continue to ignore the social distancing directives. They get together for drinks and hang out in big groups and pretending as if nothing is happening. So this is one of the biggest concerns for the medical authorities as far as lifting the restrictions is concerned.
That's right. That's why it's quite crucial that we all have to be prepared, especially local communities who may not be very much aware of the social distancing. And on top of all this, if they want to ease restriction on business community, like for example, to reopen barber salons or restaurants, they have to make sure of the rearrangement of the facility, like for example, to have people book up the queue in advance so that a group of people won't be clustered in the same salon or in the same barber at the same time. So in fact, it would be new normal, Kun Thepchai, because Dr. Tawisin has also emphasized that perhaps we really have to change our lifestyle to wear face mask whenever we go or whenever we go to the department store, and to wash hands and keep social distancing. So that would mean totally new lifestyle and new normal.
Yeah. What Dr. Tawisin said today could be seen as a trial balloon to find out whether or not the society is ready to accept this new so-called new normal. That even though if we agree to have shopping malls, beauty salons, and restaurants reopen, is the society ready to accept restrictions? As Nathai mentioned, some spacing, distancing within these compounds, whether or not this is something that the members of the public are ready to acknowledge and to comply with. So if there are signs that this is possible, then it's most likely that these places, these services will be among the first to be sort of reopened.
And one more place that they also need to revise is nursing home, especially for the elderly, because this is high risk facility. If they can minimize the risk of infection among people, especially the elderly in nursing homes, so it means that it would be quite okay to ease the lockdown measure or to ease all the stringent measures. So the 6 conditions must be under consideration at the same time, whether the whole country would be ready for the ease up of the restrictions.
Of course, we know that a lot of people, especially those in service businesses, are suffering a lot from these restrictions. And we have done a quick survey of restaurants and food shops, and we found out that most of them, if not all of them, strictly comply with the no dining in restriction and serve only for deliveries and pickup. So they're doing okay in that sense, but of course the big chunk of their business is still with dining in, right? But that's something that is forbidden at the moment. So they certainly would want to see a return to normalcy as soon as possible.